Welcome back, my dears. Welcome back, everyone. We are here now for the last stage of the PSW's directions. For the PSW's strategies and dealing with the cases of dementia or the dementia cases, dealing with dementia cases. We're here for the third part. Let's just go and share the screen first. Here we go. For the case when it's late. The late stage, like we see here, the late stage of dementia, late stage of dementia. And let me just be here. We are working on the late stage of dementia. So what will happen in this case, or what will happen in this stage of dementia? And what we have there. Let's go for the mental abilities first and check out how the mental abilities will be. Loss of ability to remember, to communicate verbally, or to function independently, inability to process information. Here, there is a very severe deterioration in the case or in the patient's status, and he's going down more and more. So loss of ability to remember, to communicate verbally, or to function independently, and so on. Severe speaking difficulties. We see also there is severe speaking difficulties. He cannot talk, severe disorientation to time, place, and people. This is the second thing. We go also for more aspects of this stage. Physical abilities. We will find that also he has increased sleep problems or sleeping longer, sleep more time longer or more often, confinements to beds, inability to sit or walk, loss of ability to speak, loss of control of bladder and bowels, so he doesn't have control on his fecal or on his urine, difficulty eating and swallowing, like the dysphagia. He got something like dysphagia, he cannot swallow the food which he is eating. These are the main aspects of this stage. And now we will go into how the PSW or the PSW strategy to deal with such a case. So here are the symptoms. Let's say here are the symptoms. And here is the strategy that should be considered by the PSW or the healthcare. Use the sense to allow the client to connect. Touch, hold the client's hand, brush the hair, give a gentle massage to the hands, legs, or feet, have the client stroke a pet or a soft clothes, smell, olfactory smell. So all here, memories can be very powerful. Introduce items such as perfumes, flour, or food that the client once enjoyed. So if you know about the client's his own habits, then do it based on these habits which he used to do. Vision DVD with quiet sense of nature, calming sounds can be relaxing for a client. Hearing, reading in a comforting tone can be soothing for the clients, even if the person can no longer understand the words. What you say is not important as how you say it. So the way you say it is important than what you are saying. Sometimes you will not understand the client, will not be able to understand what you are saying, but at least you are saying something with a mood or a tone that it fits or match with the client's needs in that, or the patient's needs in this prospect. Also, because you know that he will withdraw from conversation also in this stage. There is withdrawal from conversation. There is severe loss of the social needs, belongings, or the social needs of the patient. He doesn't want to see people anymore. He doesn't want to talk with anyone. He lost his hobbies. He lost his interests. all this. So here we should fill a box with items that represent the person's interests, favorite activities, best work, and happy memories of him. Have photos and another memorable things from memory, which remember around the client to see the provide the client with the opportunity to hear, smell, taste, or see items that are associated with the familiar things, with the familiar, his own with the familiar stuff. Also, we talk about the sleeping problems and that's in the symptoms. Provide a safe, calming environment away from distraction, no voices, no nothing, everything is clear. Ensure that the client is in a comfortable upright position during and after meals. So you will use the posture or lifting the clients to put him in a like in a fuller system, like a fuller 45 degrees. Allow plenty of time for the client to eat. Yes, because we said you have to divide the food into small pieces. You have to divide the food into small pieces. Offer small, frequent meals and snacks rather than three big meals. So don't give all the meals at once, just give snacks and few of them. Change the client's position every 2 hours and toileting schedule provide adequate hydration. These are the things which should be used with a client who has a dementia in the severe stage. In general, we want to say now supporting clients with dementia, and this is the part two of what I want to say, and nothing more to say here than what we said before. The meeting the basic needs of clients. This is the first point. Here, we should observe for signs and symptoms of health problems, provide oral hygiene for the clients. These are the regular things we will do in all the stages, in the three stages. Do not rush the client, promote personal hygiene, so that we said before, do not force the client to shower or tub, as a client with dementia are often afraid of bathing. So do not force them for a shower. No. Choose clothing options that are comfortable and easy to put on. Layout clothing in the order it will be put on. Hand the client one clothing item at a time. So don't give the client all the clothes at once. Give him piece by piece. And help him also in dressing. Help him in dressing as well. Here we go. The food and stuff, the fluids also, the fluids intakes, the food intakes and the fluid intakes also. Help in this. That is for slide. The next slide provides good skincare, promote urinary and fecal elimination, provides incontinence care as needed. The incontinence means if there is problems in bowel movement, problems in urinating. So this we call it incontinence. So incontinence care. Then also clean the perineal area and clean the client. Provide frequent toileting at regular interval throughout the day and the night. Promote exercises and activities during the day. Reduce intakes of coffee. Provide a quiet, restful place or setting. No noise, nothing. Regarding the safety of the clients, a PSW should make sure of doing the following. Remove harmful, sharp, and breakable objects like knives, scissors, and glasses. Don't put it in front of him. Since he doesn't understand it, he might bite it or catch, if it is broken, he will catch it with his hand and he will get wounded and injured as well. So make it very far from him, away from him. Provide eating and drinking utensils that cannot be easily broken by the client. So don't give him a big parts or big things. No, give him small pieces. Just divide the food into small pieces. If it's an injuries, place safety plugs in electrical outlets. Keep cords and electrical implements out of reach as well. These are some things also. Remove electrical appliances, for example, hair dryers, curling, or flat irons, makeup, mirrors, and electronic shavers. All this shouldn't be in front of him in the bathroom. No, take it out of the bathroom, or at least not make it in his reach, so he can get to it quickly because he might hurt himself or herself. Store personal care items, the shampoos, deodorants, lotions, and so on, in a safe place. So this also put in a safe place. Use baby locks on doors to cabinet that contains medications or cleaning products. So use the storing areas so that don't leave anything in front of him or her, because you don't know, he does not know in this stage or in all the stages, doesn't know how to use it, or he forgot how to use it. So he might, as example, he might drink the shampoo if you are not there or whatever. Store household cleaners and medications in locked storage. Store dangerous equipments and tools in a safe place. Supervise the client when the client smokes. Don't leave him while he's smoking, and we said this before. Store cigarettes and cigars and pipes and matches and other smoking materials in a safe place, so that he doesn't go in a risk of just playing in it or eating something not for nutrition or whatever. Practice safety measures to prevent falls, burns, choking, poisoning, and fires. Keep all doors to kitchens. These are some things also. Regarding the hygiene and grooming and dressing, it's your responsibility as a PSW to care about your clients of dementia. PSW assist them with hand washing after they have urinated and defecated, after they have coughed, sneezed, or blown nose. Anytime their hands become soiled, so the personal support worker must help them in cleaning themselves. And before eating food also, you have to care for cleaning their hands. Like we said before, help them in elimination needs as well. Provide perineal care after urinary and fecal elimination. For the nutrition, clients may be able to eat small amounts more frequently rather than eating big amounts, and we said to cut the food into small pieces. Fluids, always keep them hydrated. Always keep them hydrated. Clients with moderate and severe dementia are at risk. Risk of what? For hydration, for dehydration. So keep them hydrated always, not to put them in a situation of dehydration. As they do not recognize thirst, they cannot know they are thirsty or no. They don't know, even we said before, they don't know what the meaning of something hot and something cold. How about also the thirsty? They don't feel the thirsty, they don't feel, they can't recognize it. Encourage them to drink fluids regularly, keep water and other fluids nearby, and offer fluids whenever you are around them. So give them fluids whenever you can. There are also some health issues, like as example, changes in usual behavior as signal pain, discomfort, delirium. You can help them also to investigate and ask them what is your pain is coming from, and report it to your supervisors. Comfort, a quiet environment, keep environment quiet, no high voices, no kind of disruption or distortion. or whatever, loud voices, no. Keep everything like safe and easy. Talking in calm voice also. Do not talk in a loud voice. Messages through touch, music, and aromatherapy will also be helpful to make them comfort. By other meaning, make them always comfortable. Regarding the sleeping part, regarding the sleeping, and this is another part, encourage them to sleep and don't encourage them to take naps because naps will not allow them to sleep properly. So here, ways to enhance the client's ability to fall asleep include follow the bedtime rituals, use night lights, we said this before, so that they avoid trembling, limit caffeine intakes during the day, discourage naps during the day, encourage exercises, and reduce noises. These are the things that you should put in your concern. For the communication, we said also, approach the client in a calm and quiet manner. Introduce yourself always. Approach the client from the front. Do not come to him from the back because you must, especially when the sun down, he might get aggressive if you come from the back. So be always in front of the client. Do not approach from the side or back, as doing this can startle the client or make him agitate the client here. He might think that you suspect that you're trying to kill him or something. For that reason, you come to him from the face directly. Smile. Most clients instinctively respond favorably to a person smiling. So always smiling because to make the client or the patient calm down and relax. So smile in his face. Address the client by name. So as example, his name is Alex. Hi, Mr. Alex, how are you today? And so on. Every time you are in contact. So always talk with his name. Don't say hi, buddy, as example, or hey. No, talk to him in his name. State your name. My name is Sam. My name is John, and so on. So you have to say your name. Use language and terms the client will understand, particularly if the client is used to speaking another languages. So talk to him in simple words. Family members will often assist you with this. Provide newspaper, magazines, TV, and radio. Read for the client if this is okay. Discuss current events with the clients. Identify other people by their names. Avoid using pronouns. Don't say he or she or they because he doesn't know what are you talking about. So tell him the names of the people which you are talking about. Okay. Also, practice measures to promote communication. Use gestures, so the verbal and non-verbal languages. You have to use both in the communication. Speak in calm, gentle voice. Speak slowly. Don't speak in loud voice. Do not criticize and correct or argue with the clients. Present one idea, questions, or instructions at a time. Do not give more than, like we said, you have to speak slowly and you have to speak frequent. You have to repeat what you are saying twice or three times. And also you have to speak clear and in a clear language as well. Do not present the client with many choices. Yes, you give him the choice, but don't put many choices. As example, for dressing, you bring for him 3 pieces or 4 pieces and tell him choose one of them. He will be confused here. Provide simple explanation of all the procedures and activities. Give consistent response. Repeat information frequently. So repeat what you want to say. Slow down, talk in a slow down, then repeat also what you will say. Usually the client cannot remember new information. So that's how you will work. Also, fundamentals of dementia care for health facility personnel. We talked before about the delirium. depression, and dementia. The delirium, acute onset, can be treated. Altered state of consciousness, depression, like we said, gradual onset can be treated as well. Look for signs such as the low self-esteem in the depression. In the dementia, it's gradual onset also, and might be treated, but it's not able to be treated actually, and know from the real life situation, a real life experience. I've never seen any case of dementia which has been revealed or became back to track or back to normal. No. Memory loss and decline in cognitive functions is one of the main points of the dementia. One of the main points. And Alzheimer, like we said before, Alzheimer consists like around 80% of the dementia cases are Alzheimer, like from 70 to 80% are Alzheimer. 4.5 Americans are having Alzheimer's disease. Estimated that 60% of all nursing home residents have Alzheimer's. Alzheimer is not normal aging, means not everyone become aged that he must get the Alzheimer. No. There are a lot of people who are over 80 years old and they have a very strong memory. Learning new information make it longer and may be difficult to filter or noise. So here, the main aspects, again, of the dementia, I'm just putting them here right now. The main aspects of the dementia, first of all, amnesia or loss of memory. Keep consistent routines. So what is your strategy as a PSW here? Keep consistent routines. Use simplification. Always simplify the environment and simplify everything around you when you are dealing with the dementia case. Use simple prompts. Repeat as needed. Repeat whatever you want to say it slowly and repeat it, and repeat many times frequently. Provide visual cues, label drawers or shelves. Use procedural memory. Look at the calendar as example. Trial daily agenda or journal. Find recognizable photo. Use person life history, because most of the cases of dementia, they remember the childhood days memories, but they don't have a recent memory. Like as example, you remember what was his teacher when he was in high school, but he cannot remember what he ate in the breakfast today. And this is the point, which is the close by memory is deteriorated, and the old memory is in good condition. So know about this point. Aphasia, loss of language. Use gestures and visuals. So use the motions with the hands and visuals. Try communication cards, words, icons, pictures. All this will help with the loss of the language. One-step direction. Speak in shorter phrases. The more the phrase is short, the better the phrases are. Speak slowly, remain patient, use positive body languages, smiling, relax, and so on. So the smiling will help him also. Agnosia, loss of recognition. He cannot recognize himself and he cannot recognize the others, and so on. So always introduce yourself. When you talk with the dementia cases, introduce yourself. Use other function cells. Guide with hand over hand. Place wayfinding signs. Provide ample lighting. We said before, we talk about the lights. Use contrasting colors. Cover mirrors if needed. Demonstrate use of objects. Offer one item at a time. Don't give more than one item. I think we have discussed all these points, but maybe the names are familiar for us. Those names, affection, and this is also loss of purposeful movement. Here, the range of motions play a very big role and such. Simplify the task. focus on the steps at a time. Lift up your right arm. Demonstrate action. Guide with hand over hand. Break down the instructions. Lay out clothes in order. Use signs to guide. Socks and activity socks picks out one pair. Use previous routine. Alter perception. The perception or the cognitive of the dementia cases is very low. For that reason, you take care of these points. Loss of perceptual abilities, contrast to draw attention, similar colors to diminish, blend utility doors with walls, provide natural lights, keep lights on, use a dimmer switch, minimize glare with blinds, eliminate shadows, visible things that which will confuse the patient, avoid it. Ensure sensory aids used, be aware of visual barriers as well. Apathy, loss of motivation. Apathy is the loss of motivation. Assist task initiation, put cup in the person's hand, so help him by let the cup goes inside in his hand, let him hold it with his hand. Guide cup to their mouth, then take the cup into the mouth like this with your hand, support it. Start task for the person, bring to a favorite activity, engage in an activity, use life history, interests, music, art, Montessori, pets. Keep activity drops nearby, offer verbal cues, and utilize remaining strength. This is some points which will help us. And also nausea. Also nausea, the self-awareness. So it means the loss of self-awareness. Validate concerns of feeling, avoid challenging a person, listen and understand, give the care. Also, enlist care partners who will be with you to follow up with the dementia case. Use personal safety devices like beds, chairs, or door sensors. Know when to back off. Use creative strategies, trial visual reassurance, whiteboards, and agendas, and so on. No matter, of course, one of the main things that affected with the client or the patient of dementia, this is attention, the attention of the case of the dementia. So here, attention deficits take care. Attention deficits means lots of attentions. He is not very conscious around him, or she's not very conscious around her. So always let one person only speaking, minimize outside noises, quiet team communication, reduce distractions around him or around her, present one item at a time. Do not put more than one item in the same time, especially in food. Avoid unnecessary objects. Make use smaller visitors groups. Provide verbal cues. Simplify the environment. Make everything simple, like everything must be simple. DMC of brain functions. A is affective, B behavioral, and C cognitive, like what you see here. We are done for this part. How will the personal support worker deal with the dementia cases in its three stages? How will the personal support worker deal with the dementia cases in the three stages? And there are, what I read just now, is a common factors between the three stages that the PSW must be aware. And this is the strategies that should be used by the personal support worker to assist and support the dementia cases. We'll see you in the next part.